A single hospital room may cost more per night than a luxury hotel suite. Stay with me for a few minutes, and you may never look at a hospital bill the same way again. By the end of this video, you'll understand how 5-star hospitals actually make their money, why healthcare can sometimes feel like a business, and what's really happening behind those clean, quiet hallways. Let's start with something simple. When you walk into a 5-star hospital, you may notice the calm music, the polished floors, and the friendly staff greeting you at the door. It can feel more like a hotel lobby than a place for treatment. But behind that comfortable atmosphere, there's often a carefully planned business model working to keep everything running. Think of it like a 5-star hotel that also happens to treat patients. The comfort isn't just for show. It may be part of a bigger plan to attract more patients, keep them longer, and offer services that regular hospitals may not provide. And once you understand how all the pieces fit together, a hospital may start to look less like a simple medical building, and more like a carefully managed business. The building itself is a massive investment. Before a hospital can treat even one patient, it usually needs a huge amount of money just for the building itself. Advanced hospitals may require specialized rooms, high-tech equipment, and strict safety systems, all of which can cost far more than a regular building. This means hospitals often need millions, sometimes billions, of dollars just to open their doors. And even after opening, they may need to constantly upgrade their equipment to keep up with new medical technology, which can mean the spending never really stops. Here's a small example. Imagine building a large hotel, but every single room also needs specialized medical equipment, backup power systems, and constant temperature control. That level of detail can make hospital construction far more expensive than most other buildings, even before a single patient walks through the door. On top of that, hospitals often need multiple backup systems in case of power outages or emergencies, since even a short interruption could put patients at risk. This kind of planning may not be visible to visitors, but it can quietly add a significant amount to the overall cost of running the building. Have you ever wondered how much it might cost to build just one hospital room with all its equipment? Drop your guess in the comments. Private rooms and comfort can come at a price. 5-star hospitals often offer private rooms, comfortable furniture, and sometimes even room service-style meals. These extra comforts may help patients feel more relaxed during a stressful time, but they can also come with a higher price tag compared to a standard hospital room. This is similar to choosing between a simple hotel room and a luxury suite. Both may offer a safe place to stay, but the luxury suite often includes extra comfort, and that comfort usually comes at an additional cost. Some hospitals may offer different room categories, allowing patients to choose based on their budget and comfort preferences. This flexibility can also become an important source of income for the hospital, since patients who prefer more privacy or comfort may be willing to pay extra for it. Advanced equipment can justify higher costs. Modern hospitals may invest heavily in advanced medical equipment, like imaging machines, surgical robots, or specialized lab testing tools. This equipment can be extremely expensive to buy and maintain, sometimes costing millions of dollars for a single machine. Because of this investment, hospitals may need to charge more for certain tests or procedures in order to slowly cover the cost of that expensive equipment over time. This isn't necessarily about overcharging. It can simply reflect the real cost of keeping advanced technology available for patients. Think of it like a photography studio that invests in expensive cameras and lighting. The studio may need to charge more per photo shoot, simply to eventually cover the cost of that equipment, while still running a sustainable business. Hospitals may follow a similar logic, spreading out a big cost across many smaller payments over time. Quick question, did you know some hospital machines can cost as much as a house or even more? Let me know if that surprises you. Specialist doctors can increase costs and reputation. 5-star hospitals may attract highly trained specialist doctors, sometimes with years of advanced experience or international training. These doctors may charge higher fees for consultations or surgeries, partly because of their specialized skill, and partly because of the hospital's reputation. Having well-known specialists on staff can also help a hospital build a strong reputation, which may attract even more patients over time. This creates a cycle where skilled doctors bring in more patients, and more patients may allow the hospital to continue investing in even better staff and equipment. This is a bit like a top law firm that hires experienced lawyers. Their fees may be higher, but their reputation and results can attract clients who are willing to pay for that expertise. Patients may feel more confident choosing a hospital known for its skilled doctors, even if the cost is higher than other options. Extra services can add up quickly. Beyond the main treatment, 5-star hospitals may offer several additional services, like private consultations, physiotherapy, wellness programs, or even nutrition counseling. Each of these services may come with its own separate cost, and together, they can add up to a significant total bill. This is somewhat similar to booking a vacation package. The flight and hotel might be the main cost, but extra activities, meals, and services can quickly increase the overall price. Hospitals may work in a similar way, where the main treatment is just one part of a much bigger, detailed bill. Some hospitals may also offer follow-up care packages, allowing patients to schedule multiple checkups after their main treatment. While this can be helpful for recovery, it may also become another steady source of income for the hospital over time. Have you ever been surprised by extra charges on a hospital bill that you didn't expect? Share your experience in the comments. Insurance and private payments shape the business model. Many 5-star hospitals may work closely with insurance companies, creating agreements that allow patients with insurance to receive treatment while the hospital gets paid through that insurance provider. This can create a steady stream of income, since insurance companies may cover a large portion of hospital costs for many patients. At the same time, hospitals may also welcome patients who choose to pay privately, without insurance. These private payments might sometimes be priced differently, depending on hospital policies and available services. This mix of insurance partnerships and private payments can help hospitals maintain a stable and diverse source of income, rather than relying on just one type of payment method. It may also allow hospitals to serve a wider range of patients, from those with full insurance coverage to those paying entirely on their own. The long game balancing care and business. Here's the bigger picture. 5-star hospitals often try to balance two important goals at the same time, providing quality patient care while also running a financially sustainable business. This balance can be difficult, since medical care requires huge investments, but hospitals also need enough income to keep improving and expanding. Many hospitals may reinvest their profits into newer equipment, better staff training, or expanded facilities, hoping to attract even more patients in the future. This long-term thinking can help hospitals continue growing, while still aiming to provide effective treatment for the people who walk through their doors. It's important to remember that behind every polished hallway and friendly greeting, there's often a complex system working to keep both patients and the business itself healthy and functioning, sometimes for many years into the future. So, if you found this helpful, a like would really support this channel. And if you'd like more simple breakdowns like this one, consider subscribing. Thanks for watching, and I'll see you in the next video.